Serving all of San Diego, this is your Fox 5 News.
This morning, we're going to be looking at infertility treatments. Coming up, we'll talk about what goes into the decision and how much it could set a family back. Well, of course, the Octomom, she put infertility treatments in the spotlight and has sparked a new controversy over IVF. Joining me right now is fertility specialist Dr. Lori Arnold. And Dr. Arnold, first, if you could give me the abbreviated explanation of the mechanics of IVF.
IVF, in vitro fertilization, is a process where a woman takes pituitary hormones, or similar to the hormones she naturally makes, by injections to stimulate more than one egg. The egg is then harvested and then fertilized in the laboratory to make an embryo. And then the embryo is then placed inside the uterus after 3 to 5 days of development in the laboratory. And that's the process of in vitro fertilization.
Right.
It was initially discovered about 30 years ago for women who did not have fallopian tubes to fertilize the egg.
Okay, let's get to that then. Thank you for that brief explanation. So we're talking about the Octomom, and quite frankly, 8 children, that's just too much. You know, if you're a puppy, fine, but she's not a puppy. That's just my opinion. But do talk about the, of course, women are going to want to implant, or at least reinsert, if you will, multiple eggs because it increases your chance. So prior to, or maybe this whole Octomom controversy has not affected you, how many eggs would you, that you have harvested in the dish, if you will, how many would you reinsert into a woman's uterus?
We have guidelines. In those women that are less than 35 years old, we only put 2 embryos.
Okay.
And our pregnancy rates are over 50%.
Okay.
And there is a gray zone between 35 to 40 years old, depending on the quality of the embryos.
Yeah.
Sometimes we put 2, sometimes we put 3 to compensate for the less quality of the embryos. Over 40 years old, where implantation is 1/3 that of a 20-year-old,
right,
we tend to put 3, sometimes 4 embryos as guidelines suggested by the American Society of Reproductive Medicine.
Right.
More than that is not recommended.
Not at all.
Not at all.
Because it's just dangerous for everybody involved.
It is.
The babies, the mother, everything. Now, again, it's certainly not, it's not cheap. Some insurance covers it, some not. What's the ballpark in terms of the cost?
In California, there's about 20% of insurance companies will cover in vitro fertilization. There are 13 states where it's mandatory. The cost will vary. For example, our center will be around $7,000, but some centers will charge double that.
Now, it doesn't work every time. So sometimes women have to go through the cycle. They repeat the cycle. Is there a limit on the number of times a woman can go through IVF?
No, there are not guidelines. In fact, we have Europeans come to us from our center that have had up to 15 cycles of
Really?
IVF. Yes. And in my practice, if someone is not conceived after 3 attempts, I recommend they go elsewhere.
Go elsewhere to
Yes.
try IVF if they're
Yes.
still, you know, hell-bent on IVF.
Yes.
Do you ever in your practice say to a woman, you know, maybe you should try some alternatives, maybe it's time for it to try a surrogate, or maybe it's time for adoption?
Yes, I do. And in fact, if they have not conceived after 3 times, we attempt another methodology, either using a donor egg or a donor egg into a surrogate, or her own eggs into a surrogate.
Right, right. Talk about the emotional impact for women who might be considering this or maybe going through it right now, and talk about that for me.
It's a very emotional process, and we try to give counseling the best we can. We also recommend professional counseling. There are several wonderful counselors in San Diego that assist with our total health care for the patient, and so we strongly recommend that they seek the emotional support with a reproductive psychologist.
Right. Well, Dr. Lori Arnold, you're doing good work here. You're making a lot of families happy, and I know you said you have several success stories
Yes.
currently right now.
Yes, we do.
Tell me quickly.
Well, we have patients that have been trying 2 or 3 times with other centers, and they come to us and we see a heartbeat. And we just saw probably about 5 different heartbeats this week, in different patients, of course.
Of course, of course. Great, great, great. Dr. Lori Arnold, thank you so much
You're welcome.
for stopping
You're
by
welcome.
Fox 5 Morning News.
You're welcome.
All right. Raul?
All right, ladies, thank you.